This is your booty after a BBL. Nice and perky, nice shelf, exactly how you wanted it to be. This is your booty many years later. Fat has increased and the fat is going up your side and down your thighs. So if you're thinking about reversing your BBL today, Beverly Hills-based double board certified Dr. Yovino explains what makes BBL reversal or BBR look beautiful or not. Stick with us to the end because he's going to reveal the one thing that determines what makes or breaks a beautiful BBR. Dr. Yovino, welcome to Beauty Seek.
Thanks for having me.
Absolutely. When patients come to you asking about reversing or reducing their BBL, what are they usually bothered by?
So it's really unique because they have a lot of individual desires, but I'd say overall it's a reduction, right? And so the BBR, that R stands for reduction, reversal, reshaping. It's a correction of some sort, but I'd say globally there's a reduction desired, right? With secondary reshaping and then specific desires where they might want the whole thing taken down, the outer part, the upper, the middle, the lower. They might just want the upper part. They might just want the middle and the hip, or the lower part and the lower outer. So every patient has like specific desires. In general, I'd say if you're going to give the R a word, it's reduction more than anything.
Okay, perfect. Let's talk about what during the consult for a BBR, Brazilian butt reduction, can lead to a beautiful or not result.
During the consultation, I really get to know the patient, right? And I try to get a history of when did they have it done, how much was put into their butt. If they know how much fat was put in, that's great because I like to kind of plug that into my calculation of like what I need to be taking out to get to their desire. Were they initially happy with the outcome with their BBL and then they grew to not like it because they just fell out of favor with the exaggerated result? Have they gained weight? And a lot of patients have gained weight. Life happens, right? They might have gained 10 pounds, 20, 30, 40 pounds. They might have liked it initially and now it's too big. They might have felt like they were okay with the first one and then they had a second BBL and now it pushed them way over the edge and they wish they never did the first one, right? So they're trying to get back to their first outcome, or they're trying to get somewhere close to where they never had a BBL, but they don't want to lose their butt, so you got to really tease out their history, what was done, what life has, what has happened in their life, basically with the weight gain or not. And then really look at the patient.
That makes sense. So, beautiful or not, a patient who comes in wanting to go from the size big BBL all the way back to their original pre-BBL. Can it happen?
So, not really, right? Like, nobody necessarily, I have yet to really meet somebody who comes in and says, I wish I was back to where my butt was before, right? There is a scale, so to speak, and I'll say to them, like, if 0 is before BBL and 10 is where they're at now, where on that scale do you want to go down to, right? And I'd say the lowest someone said is 2. Nobody said I want to go back to 0 where my butt was. Now they do say, oh, I wish I never had it done, right? But they'd like some element of the transfer, right? They like having a little more butt, but they're not where they're at. So that scale, sometimes they're like, take me down to an 8, take me to a 7 or a 6. 2 is, like I said, it's kind of the lowest. But I haven't had somebody really come in going, I wish I want it all gone, totally all out. Now, they may say that initially, and then when I go to tease it they're like, no, I don't want a flat butt. I don't want to take it all out. I want this amount off.
Okay, that makes sense. But so it's very rare to want to go back to the original.
It's rare so far. I haven't had somebody ask for that, but there are patients that are like, oh, I want most of it out. And I'm like, well, what does that mean? And then that's where you got to really talk to them about like where they want it. Where do they dislike their butt? Is it the front view only? Is it the side view? Is it too much projection? Is there a shelf that they don't like? Is it too dramatic from the lower back to the step off to the butt? Is it too wide, right? In general, yeah, so we really tease out where they don't like it.
In terms of the consult going beautifully or not as well, is it a good thing for a patient to bring in their BBL before and after photos to show you what they want reversed too?
Yeah, I always encourage as many photos as possible. And that's not always the case with every procedure, right? But with this one, it's great to know what their butt looked like before BBL. Like, what is their baseline? What is like them naturally and what is not them, right? Because a lot of like baseline stuff that was there is like always gonna be there to some extent, right? So there's some flattened areas of the butt that maybe they don't like now and they feel like have gotten worse or have showed up with the BBL. And then I look at their before photos, I'm like, oh, that flat spot was always there, right? So that's something that we'll always be dealing with. So these are important things to see and point out to patients because it establishes like realistic outcomes, right? They got to know like that may not change, right? Having the photos of their after BBL, like say if they followed up with the surgeon at 3 months and they took photos, like what did that look like? And what weight were they at that time, right? Are they now like 30 pounds more than that? And nice to see, now I'm currently seeing that. I also like for them to bring in wish pics. And it's not necessarily so I can get them to look like that outcome, but it gives me an idea of what they're thinking. Like, where do they want to see their butt? What kind of butts do they like? What is the shape that they're thinking about, right? Because then I can try to get them into that arena of that type of shape. Not necessarily that butt, because they do bring in some really amazing butts that are like super smooth and likely photoshopped and all these things. I'm like, well, I can't get you that butt particularly, but I see what you mean. Like their slope is a certain shape and yours is not right now, and that's what you like. So I need to target that area more than any other place to get you in that arena. So the manyest photos as possible, honestly. Like at least for me, because I think the more information I get, the more I get into their head of like what they desire, then the better I can achieve a result that they're gonna like. Yeah, because I gotta know what they're thinking, like because you can kind of do whatever with the butt for the most part. Like I can target and it's just full of fat, right? So it's basically like a block of clay there, right? And like I can kind of make it into whatever they want within reason.
Is it a beautiful idea or not for a patient to actually return to their original surgeon who did the BBL for the reversal?
It depends if the surgeon is comfortable with liposuctioning the buttock and the surrounding areas. It's a liposuction technique, right? And but it's different in the sense that it's very targeted and it's not a go in and remove everything out of the love handle to snatch the waist. It's about removing a certain amount to get them to a certain state. And you got to know what that amount is. Like, is it 200 cc's? Is it 5? Is it 600? Is it 800? So it's a little different than trying to remove everything as much as possible. And that's kind of the mindset for all other areas of the body, right? Like your arms, right? You get arm lipo. You want to remove as much as possible, keep it smooth, not over resect it. But the idea is to remove as much without tipping it over, looking done. But you don't want to really like leave stuff behind, right? You're leaving a little bit, but with the butt reductions, you're leaving stuff behind, right? Like you're not taking everything. So you know, you got to have experience in really doing it, or doing like, you know, for me, I do a lot of liposuction. I do a lot of thin patients. I do patients that don't have a lot of fat to take, right? So I'm kind of used to taking small amounts. Although we're trying to take as much as possible, but it's small amounts, and you got to be very respectful of the tissue because these are skinny patients with like real fine tweaking, and this is like fine tweaking in the butt. But going back to your original surgeon, it depends if they're comfortable or not with it, with doing liposuction in the butt. And I would say like a lot of surgeons are not, right? And I have seen patients go back to their surgeons, and then they get talked into doing more fat transfer because the surgeon's not comfortable with removing fat, and they're thinking, oh, patient doesn't really want fat removed from it. What they want is a better shape. And let me just put some more fat in some other areas to get them that shape. And that turns out that's not what they want. They want to be reduced. That's why I was saying the R is like reduction. They don't want to get bigger with a different shape. They want to get smaller with a different shape. Right? So don't transfer fat in to try to reduce the butt.
Okay, so then is it beautiful or not to add more fat to one side to balance out some asymmetry during the reversal?
So you can, right? So that's kind of next level stuff, right? In general, we're removing fat. All right, so like majority of patients come in and we're taking fat and that's it. Occasionally, I get some patients that are very haphazard, like they're too full on the upper part, not as full on the upper part on the opposite side, too full down, you know, on the out. You know, it's just this asymmetries, right? And so we might be taking in, and this part has a little dip, and we're adding to this side, right? So adding fat is an option. I do it. It's not as frequent, and I really tease it out with the patient. If I think that they need it to really get them to their best result, then I'll do it. But if I don't feel like that asymmetry needs more fat put in, it just needs strategic extraction around it, then we'll lean more into that. So it all depends. It's patient dependent. The majority of patients, it's just fat removal. Some we remove and place in other areas, but it does add to the recovery. It changes the risk, you know, complications, although complications are very low in our practice with this. But when you're taking fat out and you're adding, right now you're grafting, and that we have to go through some survival of that fat, and you have to try to baby that area. So it changes your recovery whole process, right?
Wow. So you really are a sculptor. You are taking away from this object to sculpt and leave this beautiful booty.
Yes, that's the majority of the procedure, in my opinion, is strategic extraction, right? It's strategic removal in certain areas to get the overall picture right.
Beautiful or not, waiting a month after a BBL reversal, a BBR, to decide if you need a second procedure.
So I like to wait at least 3 months, right? But what happens is, so I tell patients during their consultation that we're going to do this and we're trying to get it just right. I'm trying my idea and your idea, we're trying to overlap as much as possible. And that outcome, vast majority of patients are satisfied, but some may say, I like it, but I want more. And I like to wait 3 months before we make that decision, or at least consider it, because there's some changes over the first 3 months. The bulk of it is really in the first month. So some patients will start saying at a month, I like it, but I think I'm going to want more off. I say, okay, maybe. Let's wait until we hit the 3-month mark and take pictures, put them side by side, look at everything together, because some patients who said that at 1 month go, you know what, that's great. I don't want to mess with it anymore, right? Because things change. There's some swelling in certain areas. There's, things will come in. The shape kind of changes over a few months. And so at 3 months, we had that conversation. And if it's a yes, if I think that we can take more and get them closer to a happy place, then we'll start planning for that. And I'm fine with doing a second BBR 3 months and beyond. Now, some patients are on the fence. So like 1 month, they might say, maybe I want to have a little bit more. And then 3 months are like, I think I want to have a little bit more, but I'm not sure. And so I said, okay, well, let's wait another 3 months. Come back at 6 months. Maybe they got some weight to lose, right? Maybe they're 15 pounds overweight, and they're like, why don't you work on that a little bit? Let it heal a little bit. There are some changes that happen beyond 3 months. Very subtle from a surgical standpoint, but there is.
That makes sense. That makes total sense. Thank you so much. We really appreciate your counseling us on what makes a successful BBR and spending your time with us.
Oh, you're welcome. My pleasure.
Beauty Seekers, we appreciate you joining us. If you like the education we're sharing, please subscribe to Beauty Seek.
I prefer small cannulas or micro cannulas. I find the smaller cannulas lead to a smoother result, less fat removed with each pass. And so it's a fine sculpting.